Hi, my name is Beth Kramer, and I'm going to be sharing my SPP entitled An Educational Intervention to Improve Registered Nurses' Knowledge, Attitudes, and Behavior Levels Regarding Mobility Practices in Hospitalized Older Adults. Immobility poses serious risks for hospitalized older adults, including loss of muscle tone, cognitive impairment, falls, and delayed recovery. One day of bed rest can result in a loss of up to 10% of muscle strength. These effects are compounded by frailty and comorbid conditions, further reducing resiliency. Although national guidelines emphasize the importance of mobility, its implementation remains inconsistent. According to Kasani, patients spend 83 to 95% of their hospital stay in bed. Hospital-acquired deconditioning has both clinical and financial consequences, costing the United States over $58 billion in 2019. This project poses the research question: does an educational intervention based on national guidelines for mobility management in older adults improve the beliefs, attitudes, and knowledge of registered nurses? The project was guided by two frameworks: Bandera's self-efficacy theory, which informs strategies to build nurses' confidence in mobilization, and the Johns Hopkins evidence-based practice model, which structured the project's development and encouraged intra-professional collaboration. A mixed method quality improvement project was conducted across 3 surgical units at a large academic facility in the Midwest. The project was implemented over a 4-week period and engaged 24 registered nurses. The assessment tool that was utilized was the Johns Hopkins Patient Mobilization Survey, which evaluated RN's knowledge, attitudes, and behaviors surrounding mobility. It also captured whether RNs had received mobility training in the prior year. The primary investigator then added 3 open-ended questions to gather further narrative insights. The intervention was delivered between a pre- and post-survey, consisted of a 10-minute digital education intervention on the risks of immobility, national guidelines, interdisciplinary engagement, and mobility techniques. The outcome of the project did not show any statistical significant change in RN knowledge, attitudes, or behaviors following the educational intervention. However, qualitative feedback provided key insights. Inadequate staffing limited nurses' ability to prioritize mobilization, especially with assignments with patients who had high acuity. Many nurses cited lack of accessible mobility equipment. And nurses also expressed role uncertainty in starting mobility and the need for clear expectations and workflow support. The significance of this mobilization project aligns with 4 key domains: nursing practice, education, leadership, and research. In nursing practice, mobilization is essential for patient safety and recovery. With education, standardizing mobility starts with standardized knowledge. Training boosts RN confidence and closes gaps in skill. Within leadership, sustainable change requires leadership which prioritizes mobility. When barriers such as staffing and equipment needs are corrected, nurses can effectively translate their training into action. And lastly, within research, the project adds to the mobility literature as to the barriers behind mobility from a nursing perspective. In conclusion, the project underscores reality. Nurses are willing to engage in mobility efforts, but the ability must be matched with operational and infrastructure and culture. These findings also indicate education alone, although very important, is simply not enough. The project next steps include disseminating this information with the unit leaders and the service line directors. Also, presenting this information at Regis Poster Day and defending the project in a formal way. Thank you very much.